what I'll do in 20 minutes at most is to present summary of previous research, more than previous research, summary of some of the questions that this initiative is trying to address, but by no means that means that this is exhaustive. So if you find a very interesting idea that is not related in the topics I highlight, that doesn't mean it's not suitable. It's meant to be a guide of research priorities. So, in part, you know, it's gonna be I'm gonna be saying stuff that we say practically during the day, because Mushfiq is open the conference talking about the initiative, so I will reinforce some of those ideas. The first one is that though it's mainly the project about urban services, we are focusing mainly on sanitation. There's concern about the trend in the take-up rates of sanitation through the world. For example, right now almost 40% of the world population remains without improved sanitation. So let me show you a figure here. These two figures have the Millennium Development Goals for water and sanitation, and as you see, the projection for water is that is more than going to be achieved, but sanitation is lagging behind substantially. So if you look also around the world, what are the areas where the lack of water and sanitation is more severe? And those are not hopefully not surprise for you, South Asia and Africa. So recapping what Mushfiq said when he opened the conference, we are going to be focusing on urban services in South Asia and Africa, most with prioritizing sanitation. So, and then we are also going to be focusing on urban and peri-urban areas, because essentially that's where now most of the poor people live, given the migration process that has taken place in the last 20 years and that is being projected to continue in the next 20 to 25 years. So this is what now people call the urbanization of poverty, and this is pressing because essentially there's a lot of negative externalities related to health, and cities are not well prepared, especially slums are not prepared at all to receive this large population. What is more, this gets aggravated in terms of investment, because many migrants are what's called transient migrants, so they move to this slum transitory, and so they don't face incentive to invest. Okay. So, okay. Finally, the focus will be on micro medium solutions to the problem of water, sanitation, and hygiene, as opposed to large-scale infrastructure investment. This doesn't mean that we are claiming that the large scale is not the long-term solution. It means that in the short term there are logistical feasibility issues. There are public finance constraints that governments face, and there are also legal uncertainties, such as, for example, that the slums might not be titled, and not being titled are not suitable for infrastructure investment. And those are issues that solving them might require large amount of time, resources, human capital, and solving logistical difficulties, and hence we're going to be focusing more on micro innovative solutions. On the micro solutions, as we say already several times, there's not only a scope for looking at new technologies that it could be very interesting per se. For example, when I was talking about slums in Latin America, I was referring to a new water system that was extremely cheap. So finding cost-effective technological change is something very useful. But sometimes we want to think also that there are many other constraints given the existing technology for which take-up is low. Okay. So basically, the urban service challenge is not purely a technical one. While there is a scope for improving transport and recycling technologies, there's also considerable scope for better understanding pricing and revenue models, incentive for politicians, and barriers to public action at the community level. Sorry, I read barriers to publication, but those exist as well, but it's not the issue of this conference. Okay, so from the barriers, we like to think in terms of supply constraints, demand constraints, and institutional constraints. On the supply constraints, mainly the main constraint we detected is the fact that basically the provision of water and sanitation service has not been a priority in the allocation of funds by local governments and stakeholders. Why? Is something that is worth investigating. And Rohini presented some very original research on this area, and more research in this line will be highly valuable. On the demand constraint, there is this issue that has come in several papers, which is a low willingness to pay, right? This randomized experience suggests this is the case in Zambia and also in Kenya. I was in a session and it came up as the main constraint. But why so is not clear, and it's very important to understand that to design policies, right? Whether we should subsidize it or not. We'll need to understand whether that's the result of lack of information, whether it's the result of externalities that are not taken into account, so on and so forth. So this is a very important area for further research. Then there is the issue of land titling in slums and peri-urban areas, which has been documented it constrains investment, and so it might be that basically that's a very important barrier for investment in sanitation specifically. On the institutional constraints, well, there are mismatches between demand for improved sanitation and the type of services provided, often results in an use or underused sanitation infrastructure, right? There's, for example, moral hazard and free riding problems that are usually arising collective action problems can be present in the area of sanitation and water, especially when they are shared. And as we heard during the whole day, that's often the case in sanitation. So we highlight key areas for further research, but I'm going to be fasting in now, and so because it'll be very nice to open to the floor, especially there's a lot of researchers that work in this area and can contribute with suggestions that will be very valuable for us. So, well, the first, as I say, will be trying to understand better willingness to pay for improved services. The second area will be understanding issues related to coordination failure and collective action problems. Here, basically, what one would like is to sort of have a well-posed model of how these problems arise and what will be solutions. So, for example, there's characteristics of different groups that have been signaled as being potential exacerbators of these collective action problems, or for example, group size or group heterogeneity. But there might be many others. So I was summarizing this paper by Oriana Bandiera and others that basically has done a survey of this literature, and they conclude that well-defined rules, monitoring technologies, the ability to punish deviators, and the existence of well-functioning conflict resolution mechanisms are typically associated with successful communities. So this basically were mechanisms through which these problems could be ameliorated. And so learning in the field about the design of mechanisms and institutions to deal with this problem is another area that we highlighted as important. Well, institutions and legal constraints, I mentioned this, but the interaction of legal or property rights with investment is another area that we have highlighted. And finally, political economy issues. This is pretty much related to what Rohini presented this morning. Because at the end, while there can be solutions to urban water and sanitation challenges, that, although those are organized at the community level, there's government investment. And as I said before, there's been lack of local government investment in this area. So basically, find ways in which the allocation of resource gets prioritized to these areas is important, and that will have to go through the political process. So understanding, again, mechanisms in which basically more resources or more accountability is directed to this area is also an area of research. And with this, I conclude with the areas we highlight, and I open to comments and discussion.
So one thing that I thought was interesting is, among the issues that you presented, some of them are really sort of very, essentially, hard things to change. Like, for example, the situation with the land titling. So I think, obviously, that's a very important point when you decide whether or not to invest in improving your situation, whether you have property rights or not. But in a sense, we agreed to that. But is that something that's within the scope of sort of possible policy changes that can come from this? Is that something that we expect, or is something that we sort of are optimistic about?
Well, let me see if let's put it in this way. So there's a lot of programs and governments providing land titles through the world. So I don't think that's difficult to change. Actually, I think it's something. It's been very extensive intervention. Sometimes not even being efficient, because not always is efficient given size of the plot, for example, to provide land titles. So I couldn't be pessimistic if the recommendation of policies that providing land titles has a large effect on take-up of sanitation. In that way, I will be optimistic. Now, for a randomized evaluation in a concrete program, whether it's feasible to, at that micro level, generate a land title randomized variation, that I'm more pessimistic, right? Because that, because it's more like a macro solution that we would like to evaluate at the micro level. So if that's clear. So to summarize, I think if we were going to come with the answer that, yeah, it's very important to provide land titles, then I think it's feasible. Doing at the micro level is more difficult. I'll give you one example in which I was involved. Well, okay. So I did long ago a paper on water privatization in Argentina, and then the private water company came to talk to us and say, we have this issue. We are providing water to the slums in the city. And the reason is because, it might be that no one is providing water to the slum. And it might be that the children die and it's going to appear in the newspaper. And we are running the water system for the cities. But it's not our responsibility because these slums are not legally part of the city. They are not in the maps, and no one has title. And so they wanted to evaluate. They were having a social program, okay? And so they wanted to connect the slums to the network, not just a micro solution, a macro solution. And the way they wanted to do that is because they said, well, sometimes it's 3 blocks from the network. It costs nothing to us to extend the network for 3 blocks or so. And the main problem was that, so they have to sign agreements with the local governments, and then the local government have to issue the title, and then they can do it, and they did it. So, and then we did a paper on that. So it's possible.
One other topic that I didn't see mentioned here explicitly, but I think is tractable for some of the folks here, and that really is a live policy topic, I think, is the interaction between livelihoods and service provision in water and sanitation. And give you 2 examples of that, and solid waste more generally. One example of that is waste pickers and the work that they do. We often think when we're talking about solid waste management about introducing new technologies that are in practice labor saving, and so you're displacing people from their jobs. How should we think about that trade-off? What does that trade-off look like? So I think that's a live topic that's of real interest. And related to that in sanitation is the issue of what in India we call manual scavenging, manual emptying of pits. That's technically illegal in India. It happens all the time. We've just pushed it underground so that those people can be exploited even more. And you often hear kind of rhetoric about end manual scavenging, end manual emptying, because this could be a good thing for dignity. But of course, that's somebody's job, and what's their job going to be instead if they're not doing that? On the other hand, maybe there are public health implications of ending that are positive for the community. How should we think about those trade-offs between private losses and public benefits? I think that's another live policy question, and it's actually something that you could imagine being tractable. And another point is that I didn't see here, that's one level above some of this very macro stuff, is competition in service delivery. What do we know about competitive practices in when contracts are awarded for emptying those garbage facilities, like the pictures that we saw from Rohini? What are the prices like for those services, and how are those contracts awarded? Can we improve the competitiveness of giving out the right to service these communities? And is that competition policy, or lack thereof, part of the reason why we're in this cycle of low willingness to pay and low service quality, and is it part of breaking that bad cycle?
Yeah, so all great suggestions. Let me take on the last one. Not just because I have something to say, not because it's more important or less than the others. So I love to see research and competition. I think it's key for our thinking as economists, and and I'm in Dominican Republic, randomized competition, but it's really hard to do it because you need to have many markets, and the mere definition of market is something that's difficult to achieve. But in most of these areas, I'm not an expert in South Asia, but I could easily imagine that if there is a firm providing this service, to an area, it's just one, right? And it's hard to, it'll be hard to randomize the sort of level of competition at that area. But if I'm wrong, it will be a great topic. I don't, at the conceptual level, I totally agree. The feasible level seems to be the issue.
Among the topics that you recommended for future research, there were many like institutions for collective action and institutions in general, social institutions and things like that, which according to my knowledge, correct me if I'm wrong, at least in the perspective of neo-institutionalism, the existing research in that area is very qualitative, and they use different methodologies, like non-quantitative methods. So how do you suggest to carry out randomized evaluations in these areas, if you're suggesting that?
Well, I mean, I think Moshe, why don't you just give the example of the externalities? So it's a concrete example you are working on, and so it's much better.
So during I already talked about this ORESA project, which is about governance structures, which one could randomize if you have sufficient number of units of, say, toilet facilities. Right, but even simpler example, which can happen at the household level, is so the decisions of some households to invest in improved sanitation is often dependent on the decisions of other households surrounding them, right, for various reasons. So it could just be a simple epidemiological externality, right, that I'm not going to invest in an improved toilet. I'm not going to spend 2,000 rupees or 2,000 taka on an improved toilet because my kids are going to get sick anyway if everybody else is open defecating, right? So that's there are sort of community level interaction effects that you can study there, right? And understand how community and how do you get around that problem? The community jointly has to make some decisions, right? Which can be subject to innovation, experimentation. How do you get communities to jointly commit to doing something different? And which is actually what's underlying CLTS, I think, right? Where the entire community comes together and they make a joint commitment.
Yeah. So, in that sense, also like you're still looking into the individual. I mean, taking individuals as basic unit of analysis, right? Rather than
yes,
social.
But understanding their interactions, right?
Right. Okay.
Yeah.
Thanks.
But just let me add or clarify that these were like a couple of areas we wanted to highlight that were not like the obvious demand side to study prices, but I also emphasize a lot that it's understanding willingness to pay per se interacted with property rights or externalities is very important, but just the pricing policy per se is important as well, right? And these were suggestions. It's not that it has to be only these topics.
I have a similar question again, maybe coming from someone completely new to this kind of analysis, is that in my experience of sanitation in low-income communities in Sri Lanka, it seems that the most important factor for success instead of failure is the presence of one committed individual, either a community leader or a technical officer in the local authority. And how can you include that phenomenon in this analysis?
Well, ideally we want to randomize these persons across communities, but that's gonna be difficult. So perhaps the training, what you can do is to randomize. I'm trying to making it up, trying to randomize the training and support of those individuals at the community level, right? Suppose you take communities and somehow you do a baseline and you try to measure these capabilities, social capital, and then whatever is this variable that measure the presence of this type of in the community. And then you stratify then by whether they have it or not, and then among those that don't have, right, you can randomize, and one will have the support, the part of the treatment will be the provision of this person, like the training and maybe some payment to this person to play a role, and that way you can sort of exogenously generate this presence.
Can I just add to that?
Yeah.
So continuing with that same example, so your example suggests that there are some people who are more influential than others in their community, right? That they take on a leadership role, their decisions then affect like either their effort or just the observation of their decisions affect others, right? So one could easily imagine projects where you play around with, you try out different ways of using these, say, opinion leaders or influential people, right? Getting them to change behavior, and then, or identifying, how do we identify, when we go into a new community, how do we identify the most influential person, right? And let's say, we might have different ideas. So it might be a political leader. You might think it's a political leader who matters. I might think it's the most educated person, the person who's viewed to be most sophisticated that matters, right? And we could certainly go in and test your idea against mine, right? We go in and bribe the political leader to change his behavior and then study the influence it has on others. I go in my communities and bribe the educated person to change his behavior and look at. So that's just one simple example of.
No, actually, it's not, because of course I am looking at it from long after implementation, and I go in to look at things that have failed, and there are a few places only where it's successful. So it's not so much, so you are trying to make that person that I see later on. Is that it? Yeah, okay.
Exactly. Right. Yeah, so you observe something that works, and now I'm trying to reverse engineer that, right? And that might be subject of experimentation. How do we engineer that person?